What is the science behind lasting mastopexy breast shape? Imagine lifting a drooping balloon to restore its youthful shape. That's essentially what a mastopexy or breast lift aims to do. The key to making that lift last involves understanding how the body's tissues respond to surgical changes over time. When surgeons perform a mastopexy, they focus on removing excess, stretched skin, reshaping the remaining tissue, and repositioning the nipple-areola complex to a higher, more natural spot on the chest. This combination helps restore a more youthful, firm appearance. The durability of the new breast shape depends heavily on how well the skin can contract and maintain tension after surgery. Skin elasticity varies from person to person based on age, genetics, lifestyle, and skin health. If the skin is very elastic, it might stretch again over time, which can affect the long-term results. That's why surgeons carefully evaluate skin quality before choosing the best technique. Inside the breast, reshaping the tissue is equally important. Surgeons reposition and sometimes tighten the breast tissue to create a supportive internal structure. This internal support helps the breast resist the pull of gravity and maintain its shape longer. Techniques differ depending on how much sagging exists. For mild sagging, a simple lift might suffice, but for more severe cases, more extensive procedures like the Wise pattern or anchor technique are used to remove more skin and reshape the breast. Repositioning the nipple-areola complex is a crucial part of the process. The surgeon moves the nipple higher on the chest wall, restoring symmetry and a natural look. Preserving blood flow and nerve connections during this step is vital for nipple sensation and health. The choice of technique depends on how much the nipple needs to be moved and the amount of skin excess. The surgical approach is tailored to each person's anatomy and the degree of ptosis, or sagging. For mild sagging, less invasive methods like perioroller lifts may be enough. For more significant sagging, surgeons might use the Wise pattern or anchor technique, which involves more extensive skin removal and reshaping. Advanced methods like structural mastopexy create an internal framework by suturing tissue to itself or to the chest wall, providing extra support for the long term. Sometimes, surgeons combine a breast lift with implants to restore volume and improve upper pole fullness. This internal support can help the shape last longer and prevent the breasts from sagging again. Using the patient's own tissue for augmentation is another option, but it is less common. Despite all these efforts, it's important to remember that no surgical procedure can stop the natural aging process. Factors like aging, hormonal changes, pregnancy, breastfeeding, weight fluctuations, and skin health can influence how long the results last. Proper postoperative care and maintaining a stable weight can help preserve the lift longer. In summary, a lasting breast lift depends on a careful balance of removing excess skin, reshaping and supporting internal tissue, and repositioning the nipple. The choice of surgical technique is personalized to each patient's anatomy and degree of sagging. The interaction between skin elasticity, internal support, and surgical precision determines how well the breasts maintain their youthful, lifted appearance over time. Always consult with a qualified plastic surgeon to discuss your individual needs and expectations, as they can tailor the approach to help you achieve the best, most durable results.